Hello everyone and welcome back to Sammy Boswan Official. Today we're going to be talking about chronic kidney disease, also known as CKD. So I'm going to be teaching. I have my book here. Hope you have your book and pen. Let's get rolling. This is a very important topic, especially for nursing students, healthcare professionals, and even the general public. So you too, you're also important to learn about this because you're a human being. The most intriguing part, people have this without even knowing. So let's roll on. Now, in this video, I will explain the functions of the kidney, the causes of chronic kidney disease, what is chronic kidney disease, signs and symptoms, stages, diagnosis, management, prevention. So now let's roll on. And also by the end of this video, you understand everything clearly. So now, what are the functions of the kidney? Number one, the kidneys are very important organs in the body. Yes, they are used in filtering toxins, waste products from the blood through urine. They help maintain fluid balance in the body. Thirdly, they regulate electrolyte levels such as sodium, potassium, calcium, and they also help control blood pressure. They promote hormones that help in red blood cell production and bone health. When the kidneys are damaged, these functions are affected. So you see that these are the functions of the kidneys. So when there is a problem with your kidney, these things could be a problem too. Now, what is chronic kidney disease? Chronic kidney disease is a long-term condition where the kidney gradually loses the ability to function properly. It develops slowly over months or years. In chronic kidney disease, the kidneys cannot effectively filter wastes and excess fluids from the blood. That means that the fluids will now become accumulated. This leads to accumulation of toxins in the body, which can be dangerous. If not treated early, it can progress to kidney failure. So what this is telling you about is that when there is a problem in the kidney, when there is a chronic kidney disease, you can filter your waste products. There will be accumulation, and that could be a very big problem. Now, the most common cause include, because there are causes of chronic kidney disease, we have diabetes. This is the number one cause worldwide. Diabetes is the main cause of chronic heart disease. We also have high blood pressure. It damages kidney blood vessels. We have kidney infections. We have glomerulonephritis, inflammation of the kidney filters. And we have prolonged use of harmful drugs, genetic kidney disease, urinary tract obstruction. This condition damages the kidney slowly. So when you are nonchalant about your kidney, that could be a very big problem. Some of us don't care. No, we don't. But bringing this thing to light can help you understand that your kidney is very important, because everything you eat, everything you drink, whatever goes into your body passes through your kidney. But when there's a problem with your kidney, that could be a very big health harm. Now, we're talking about the signs and the symptoms. In early stages, there are no signs. So when it comes early, there are no signs at all. But as it progresses, symptoms include, you have fatigue, you have weakness, you are always weak. All the time you're weak. You have swelling of legs, feet, or face. We have reduced urine output or sometimes increased vomiting. We have shortness of breath, nausea and vomiting, loss of appetite, persistent itching, and high blood pressure. These symptoms occur because waste accumulates in the body. So these early signs and symptoms shows us that when there is chronic kidney disease, you can feel weak. Yes, because there is overload in your body. You can see swelling of the legs because there's so much accumulation that you don't even know where to remove from. And most of these people that have this kidney, and they end up having pipes in their body because that is the only way they can drain those accumulation out. So caring for your kidney is not something they talk about all the time, but you getting through to this video understand that it is very, 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 very important. Now you can have shortness of breath, you can have nausea and vomiting because whatever you eat you're just actually vomiting it back. You have loss of appetite, you see, and you can have itching and high blood pressure. And high blood pressure these days are most things that we overlook because of nonchalant behaviors. So when you see these signs and symptoms, you need to really run to a health practitioner. Now we're going to go to the stages of chronic heart disease, chronic kidney disease. So number one, we have mild kidney damages with normal function. So the normal function of the kidney is just mildly damaged. You can still filter some toxins out of your body. Now mild loss of kidney function, meaning that the functions of the kidney might be a little stopped for a while. We have moderate loss of function. It's kind of just in the middle. Then we have severe. This is whereby the functions of the kidney are totally gone. Then we have the fifth one, kidneys failure, also called end-stage renal disease. At stage 5, dialysis or kidney transplant may be needed. So at this stage, there may be transplant needed for you to survive and to get on with life. Now we have these stages are not really looked at because when some people have stage 1, they feel like okay, I'm okay, it's just a mild loss of the kidney. But when it progresses to level 5, you know how hard it is to get somebody that can be a donor for you. It's very, very, very hard. So we just have to be very, very vigilant these days. So we have diagnosis. CKD is diagnosed using blood test to check creatinine levels, urine test to detect protein, glomerular filtration rate, also called GFR, ultrasound to check kidney structure, very, very important. Early diagnosis is very important. So early diagnosis of CKD is very important because when you give a nonchalant behavior, the problems that come with it are very, 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 very painful. So early diagnosis is good because it helps to detect it early and can be able to treat it on time. So we go over to the management. So you see, it focuses on slowing disease progression. This includes controlling blood pressure, managing diabetes, avoiding harmful drugs, maintaining protein diet, reducing salt intake, taking prescribed medications in severe cases. Dialysis or kidney transplant may be required. So this management, it says controlling blood pressure. It says that blood pressure can also be part of the causes. So when you control blood pressure, you're reducing the cause. Then diabetes. Most of us don't like eating protein-rich food, which is bad because when you don't eat protein-rich food and always carbohydrates, then you are attracting diabetes to yourself. Then avoiding harmful drugs. Most of us who take drugs without doctor's prescription, you're really killing your kidney because your kidney filters those drugs and collects important nutrients. And when it takes an overdose, you could know what that means. You really know how that can actually affect yourself. And most of the time, they usually go for kidney transplant. Most of the days it's successful, but sometimes they don't usually make it. So taking care of yourself comes first. Very, very, very important. So we have the prevention, controlling BP. So you have to control your BP at all times. Go for regular checkups. It's advisable to go to BP checkups to know your BP. Control blood sugar, very very important. When your blood sugar is not controlled, you could have a very very big problem. Drinking enough water. Doctors will always advise that before you wake up, you have to drink water. At every point of your life, drink enough water. Regular medical checkups. Maintaining a healthy lifestyle. Prevention is always better than treatment. It's always everywhere. It is better to prevent this chronic kidney disease than going to treatment, because it will cost you your time, it will cost you years of your life, and it will cost you resources. So prevention is better than cure. Then we have, in conclusion, in summary, CKD is a serious condition that affects kidney function over time. Early detection and proper management can prevent complications. So if you found this video helpful, please kindly like, share and subscribe. Thanks for watching, and see you in the next video. Chronic heart disease must be taken very very seriously and important. Thank you.